Hi everybody, welcome to my channel. Today we are going to discuss regarding an important topic related to the nursing foundation. In this subject we discuss important two topics. First one, different roles of nurses. Second, trends in nursing. Let me start. The topic was different roles of nurses. First one, autonomy and accountability. Second, caregiver. Third, advocate. Fourth, educator. Fifth, communicator. Sixth, manager. Let me discuss one by one. First one, autonomy and accountability, which means nurse should be able to initiate an independent nursing action without any medical orders within the scope of practice. For example, initiation of cold sponging to the client with a fever, and nurse is always responsible and answerable for the quality of care provided to the client. Second, caregiver. Nurse act as a caregiver. It means which helps to the client to achieve a maximum level of functioning independently by providing a good care. Third one, advocate. Nurse act as an advocator to a client by protecting the client rights to be treated equally without any harm intentionally or unintentionally. Fourth one, educator. Nurse educate the client about a disease process and its management. Nurse demonstrate and educates the client about the health condition or health activities to promote the healthy lifestyles. Fifth one, communicator. Nurse act as a communicator. It means it is an integral part of a good relationship between the health team members and the clients. Nurse communicate to the client about the disease process and its management and the progress. Sixth one, manager. Nurse manager are responsible for managing a nurses within healthcare environment, and she is responsible for creating an environment that promote a culture aimed at enhancing the quality of life of the patient. Seventh one, researcher. Nurse act as a researcher to investigate the role of nurses which further improve the nursing practices. Next topic is trends in nursing. First one, evidence-based practice. Second, quality and safety of education for the nurses. Third, new technologies. Fourth, genomics. Fifth, public perception of nursing. Let we start one by one. First one, evidence-based practice. It means to provide a high quality of nursing care through evidence-based practice. Second, quality and safety of education for the nurses. It means to provide a regular education to stay updated with the healthcare changes. Third one, new technologies. Emerging technology that contribute to sophisticated diagnostic treatment modalities and development of health and telemedicine, etc. Fourth one, genomics. It is an study of inheritance, and nurse should use the study finding ethically and for the upliftment of mankind. Fifth one, public perception of nursing. Nowadays, public is aware about the consumer rights and rights of patient. Always provide a high quality competent care to the client to avoid medical errors. Thank you for watching. Please subscribe my channel for more videos.